Well, I'm really lucky today. I have Josh Livers, my treasured osteopath, who's been working on me for a while, and also on Cassie. And Josh, what got you into osteopathy? What got you into?
Well, my mum, yeah, well, it's a family thing. She wasn't an osteopath, but she was a health professional, a naturopath, and a homeopath, and then went on to do a PhD in nutritional biochemistry. So she would have been my biggest influence, I think, in wanting to become a health professional, wanting to help other people. She was definitely a big motivating factor in my decisions to, follow health. Um, yeah, she really unlocked that passion in me for sure.
Yes, you've got that. You've got that. And I feel it on the table. We've had very profound experiences on the table. Um, we had a great discussion, didn't we, about Professor Pollock's water. And it was almost the reason I asked you to do this Zoom meeting is that it was almost like a conjunction of the planets because of the experience that I had in Kakadu that we talked about.
Yeah.
And seeing that the water over there appeared to everything that I could understand to be identical with Gerald Pollock's fourth stage of water. And you got into the same thing, didn't you? You got really impressed by his theories.
Yeah, absolutely. I think I mean, not I think I think it's pretty evident through the reading and the application of that theory of fourth phase of water. I think applies greatly to a lot of the unknowns that we know about the body and the biophysics and the biochemistry of the body. There's a lot of factors and a lot of things that I think he has discovered or unlocked about water that actually explains a lot of physiological processes that we didn't quite understand before.
What were the ones that impressed you?
Well, there's the age-old question in physiology where blood cells are actually larger than the capillaries they travel through. And so the fine capillaries of the fingers, the nephri of the kidneys, the eyes have exceptionally tiny capillaries. And, through the understanding of the fourth phase of water and sort of explaining how we explained how the water creates a charge and that charge creates almost like a battery, which then creates energy. That theory can be, I think, easily applied to the movement of the blood through the capillaries, and it's actually that energy, that power that the water creates by separating the charge is what actually powers the red blood through these smallest capillaries, and it allows it to deform, but not only deform, but then also that deformation actually allows it to travel through the finest capillaries of the body. Okay, whereas in the larger arteries, there is plenty of space and plenty of plasma and plenty of fluid to then carry the red blood cell. Right, so obviously the red blood cells float within the plasma fluid. And when we get down to those tiny capillaries, the amount of plasma that's coming through is very small. And so there's this energy that water creates by separating the charge that provides the force to which pushes the cell through the capillary.
Yeah, yeah, I get that. I mean, that energy you're talking about is fundamentally, in my understanding, ionization, and it's the negative charge, or the negative ionic charge, which is very significant for me because we've talked about it for years, and we've always said, oh, well, it's antioxidant. Well, okay, but what does that actually mean in terms of a body? What it means is that it has the ability to donate itself to a free radical. And as a result of that, do this beautiful big orgasmic reduction, they call it reducing water, into pure water again. So I love that idea that your water should be energized, and naturally your water is energized. And this is what I was getting back at Kakadu, and that is that the water that our ancestors, those thousands and thousands and thousands of years ago, were drinking, they were adapted to that water, so their actual body had decided what water it needed. And my feeling is that Pollock's got it. He's on it. and we are talking about bioidentical water in the body. But you mentioned when you were talking, you mentioned about the pulsation of water, which I found fascinating. Would you like to share that?
The movement of water within the body.
Yes.
Is that what you mean?
Yes. Yes.
Yeah. So in osteopathy, there's a few sort of tracks with osteopathy. Within the field of cranial osteopathy, there is a thing that we discuss or talk about, and it can be palpated. You can definitely feel it through your hands. It is essentially this cranial rhythmic impulse, or what osteopaths refer to as the either the breath of life, if you're being more esoteric, or if you're being a little bit, we call it the primary respiratory mechanism. So it's the movement of fluid through the body that is present even during the first moments of conception. There is movement of fluid, toing and flowing of water within the fertilized egg. That movement remains inside the child. This movement of fluid, this ebbing and flowing of fluid and tidal movement of the water remains in the body prior to them being born, and then they get their second breath of life, which is secondary respiration, which is breathing. So this tidal movement, this cranial rhythmic impulse, this breath of life is present within all living things. It can be palpated within all animals. It's not only for the humans. It is something that is palpated through all living things. And what we feel when we put our hands on, I mean, everyone feels something slightly different. Essentially, everyone's experience is different. However, the general consensus, it is definitely what I'm feeling when I'm holding on, is this tidal flow, this swelling and receding within the body. And it's not the same as the respiration. Respiration is easy to feel. Everyone can feel it. You know, when someone takes a big breath in, that is a very mechanical respiration. Whereas what we're talking about is a very innate respiration that happens when you are breathing, what happens when you hold your breath, it happens when you're underwater, it happens when you're sleeping. It's a constant tidal movement. And what I'm trying to assess when I'm feeling someone or assessing this part of their physiology is I'm assessing that when that movement is disrupted, restricted, or damned in some way, that's when disease occurs in the tissue. And so my job is to help to get that fluid moving back into tissues to allow that tissue to then express its health and its life, and that enables healing to then occur. So as an osteopath, you know, when you brought up the water during that treatment, it definitely excited me, because I do feel like that is something that I do work with every day with every patient, is trying to, you know, improve the movement once it's in the body. And I guess, you know, where you come into it is you're actually providing the sustenance that provides the water to the body. So I thought we connected pretty well on that.
We did, didn't we? It seems to me that when you were talking, that you're talking about, I mean, as you mentioned, the breath is mechanical. And yes, of course, the baby's born, the baby maybe gets a slap or something, the baby starts breathing, and that's kind of a first life thing. But talking about the water in the body as a life force really excites me, because it goes to a level much deeper than our normal accepted physiological understanding. And for me, I'm constantly amazed at how little people consider water to be important. And when we talked about it, to see that water is actually life itself, that's really exciting for me.
Yeah, it is. I mean, it really is. It is the key to life, particularly as we know it.
You would tell, I'd love you to share something you told me about how you were trained to feel this, how you work with an old osteopath. Could you just relate that story?
Oh yeah. When I was in my, I think I was in my end of my third year of osteo training. It's 5-year degree. 3 years in, I met a mentor of mine, a really great man named George Stillian, and he essentially allowed me to spend 1 day a week in his treatment room, and he would essentially allow me to hold the feet or hold onto a part of the body of the patient while he would do his work. And by doing that at the start, I would just, I was learning, I could feel nothing. I just felt like I was holding a couple of sticks in my hand. And then slowly, after months and months of practice, you start to pick up the swelling and receding. And what's really interesting is that from that experience, I could, as I was holding, and he would be maybe, I don't know, releasing a part of the neck, or I don't know, a cranial lesion or something like that. And I would feel the body have this flow. And as he would put tension into the strain, you would feel the flowing sort of recede to almost a still point. And in this still point is, in osteopathy, is where that's where the true healing occurs, is when the movement sort of sits and be still. And then after that moment, you feel this sort of, it can be a minute, could be 2 minutes, the still point, could be a really long time if someone's really unwell. The healthier they are, the quicker they move from this still point. And that's when that still point breaks. It's like this, it's like almost like a dam. It's like all of a sudden that swelling and receding opens up, and there's an improvement in the quality, the quantity, how it feels. The symmetrical nature of it becomes more evident. And so essentially what he's doing is the strain patterns or the dysfunctions within the body create biophysical issues or biophysical dams or biophysical restrictions that affect that free flowing movement of the fluid or free flowing movement of the cranial rhythmic impulse. And when you can get that movement back into the body's natural healing processes can then occur. Whereas if it's a really stuck system, a lot of interventions generally aren't as effective unless you have appropriate fluid movement, CSF movement throughout the whole body.
So what I'm hearing is that the continued free flow of your life water is the objective of your treatment, and the type of water. And the type of water you're talking about is where we both got excited when we talked about Professor Pollock, because this is the water that we're producing. This is the water that people are drinking, and this is the water that the body is actually asking for. That's what excites me, that those people back there in Kakadu 30,000 years ago, they were laying down the template that you're working on today. That's incredible. And so what I hear when you're talking is that the body knows what sort of water it really wants. It's imprinted. What effect does, this is a bit of a left field one, but given the importance of water in the body, which is, you've brought up that it's far, far, far more important than the general consensus or what people are led to believe. What about levels of hydration? Because I can remember Dr. Abram Hopper. He was a psychiatrist, and he worked in an asylum, and they used to put electrodes on people. And he had a very old schizophrenic who had regular electrode treatment, and they found he was so dry they couldn't get a current to go through him, which is amazing that he was still alive. So can you see that? Can you, in your experience, how important is adequate hydration?
Well, I mean, adequate hydration is essential. I mean, why is it that a baby or a young child feels so vital, so healthy, so, and obviously not all children, obviously they're sick children, but in general, they are exceptionally hydrated. They are exceptionally buoyant and fluid. And that's, you'll find very few children complaining of aches and pains or chronic pain unless there's a serious issue going on. They don't get that general stuff that the rest of us seem to get. And it is shown and proven that we do dehydrate over our lifetime. We essentially start at a percentage, the number eludes me, let's just say 30, 95% water, or, whatever, most water. And over the course of our lifetime, we do decrease the amount of fluid that's withheld within every cell. And that is, I think, a big factor in why not just, not aging, because aging is a time continuum, but rather the increase of pathology, the increase of dysfunction, I think, is in correlation with this decreasing of water and then this increasing of body dysfunction, chronic disease, illness. And you can definitely feel that, like, as a manual therapist, they always say that if you can create change, it's easy to create change when the person is young. It's very hard to create change when they're older. And it is my belief, and also, the belief of George, that movement of fluid over time with physical trauma, emotional trauma, structural trauma, all impedes the fluid motion, which then results in disease later down the track. And so I would just put out there that someone who has a neural system of schizophrenia, or, and there's varying levels of schizophrenia, but a high level of schizophrenia, will generally have really compressed skulls, compressed cranial sutures. And those cranial sutures are supposed to breathe almost like a fish. They're supposed to be able to move. And that movement allows the CSF flow. Yeah, get it in there. That movement allows appropriate travel of the CSF from the brain down through to the sacral area and then back up.
CSF for our listeners.
Cerebral. Yeah. Yeah. So potentially, just deducing without seeing the guy in front of me, there is a high chance that he had probably suffered from some severe cranial strains, which could easily reduce the movement or the free-flowing movement of the primary respiratory mechanism, which then results in a dehydration of tissues over time. And I think it's really important to understand that chronic dehydration is it's not like you feel thirsty. Feeling thirsty is acute dehydration. I'm feeling thirsty now. Whereas chronic dehydration is what we're seeing more and more of in society with all of the coffees and the teas and everything else that we're drinking, is that it is a slow, very slow incremental decline from a high amount of fluid. And it's so tiny that we don't notice it over time. However, I read not recently, but a few years ago when I was really diving into this, there's some studies coming out of Japan that just show the literally drinking water can be a therapy for a lot of chronic illness, including osteoarthritic changes. There's blood pressure issues that can be addressed with drinking more water. A lot of chronic illnesses that we all deal with today that's common have been shown to have a link with this chronic dehydration that happens slowly over time. Yeah, so it's a combination between not hitting our water targets from a young age, and our body just gets used to it. We're a homeostatic mechanism that just goes, no, we only need this much, we only need this much, we only need this much. And we can sort of wean ourselves to a point where we're only drinking soft drinks and we're only drinking, tea and coffee and essentially polluted water.
This is normal.
Yeah.
Yep.
Yeah.
And those drinks do not hydrate,
No, that's you can actually tell, like they don't quench the tongue. They don't quench that thirst, that real thirst that you need to be quenching.
Yeah, I remember Harajat Wisma, who's a kinesiologist, would test you on tea, coffee, Coke, anything, with the old touching it, etc.
Muscle testing.
And the only thing that worked was water. And if people were having trouble, if she was having trouble treating them kinesiologically, she just give them water, but she couldn't give them anything else. Water is the only thing that changed things. In my case, I've got a little scale that I go onto every morning after the shower before breakfast, and it does all of my body mass index, muscular weight, etc. And it's all great. I'm doing great. The one thing, okay, everybody, I'm 74, going on 75. The one thing that really frustrates me is my hydration level is going down. I've actually tried to test it by drinking lots more water, but it's not changing. So, here I am, the great waterman, telling everybody about the best water you can possibly drink, but I'm hearing from you that systemic dehydration is as much to do with aging and the habit of never having enough water, which happened early in life, which I'm now reaping the bitter harvest of that I'm actually holding less water the older I am.
Well, exactly. So essentially, if you think of it again, like to that homeostatic mechanism, if we slowly dehydrate ourselves over the course of 50 years, you not only are you used to less water, but if you all of a sudden pour lots of water in, you excrete it because you're not used to holding on to it. So this is, because your kidneys are the same thing, they're linked to this homeostatic mechanism. So that's why it is important to be, starting young always, generally, start as young as possible when it comes to hydration. But also just, being aware that it's, it's not as easy as just drinking more and things change. You need to drink more of the right fluids. And then timing also makes a difference. I mean, with drinking more water on an empty stomach is a better time for absorption. Yeah.
My difficulty is that the water that we're being given today with the 600 identified but unexplored contaminants. An example is American water. In Australia, we've got the trihalomethanes, which are the result of the chlorine uniting with organic matter in the water, et cetera, et cetera, et cetera. Our ancestors never had any of these problems. So the template they set down doesn't account for that, which means to me that my body has to do all of that work on the water that it drinks. To squeeze any essence out of the water that it can. And we're actually, it's kind of like giving your car petrol with water in it. It's not made for it. It doesn't work properly. So that for me has been hard to accept because culturally you never had the opportunity to understand. And I also thought about those Kakadu guys sitting in that cave painting on the rock face, and I thought they either had water or they didn't have water. They understood how incredibly important water was. And they have a wet period where the whole of Kakadu floods, and they have the dry period where it's a dust bowl. So their reverence for water and their understanding of water can't even come close to. Our culture doesn't allow that. Furthermore, our culture is pushing every alternative to water that we could possibly imagine. So, Josh, this is marvelous stuff, man. This is marvelous stuff, and thank you.
You're welcome, man.
If you can convince 10 people who watch this video to drink more water every day, this video is worthwhile. But I'm going to put it out to as many people as I can, and there will be thousands of people looking at it. But it's so seminal, isn't it? It's so foundational that we just Western ways we went right over the top of it. We lost it. So thank you, Professor Pollock. Thank you, Kakadu people, our ancestors. Yeah, thank you, the template that is in me right now that is telling me what I should be doing. Josh, you're incredible. Thank you. And anybody wants a good naturopath, Josh Livas, Livas. I was just corrected. Osteopath, sorry. Okay, Josh, thank you so much. Thank you.
Take care, mate. Good to see you.